My name is Dick Freeman. I'm a membership chairman for the Mended Hearts of the Coachella Valley. We're even here this evening over here. We're in partnership with Eisenhower Health, bring to you a 9th current series of cardiac lectures. We're going to have a very interesting one this evening, and I'll go ahead and explain that later. Okay, sorry about that. How about now? I'll swallow this mic. That's what it takes. Okay. A little about the Mended Hearts. We've been around for about 70 years. There's about 270 chapters, and right now we're even international. So there's quite a few individuals over here. We're very pleased. Right now, you're probably used to seeing Bill Stark here. Bill and Carol right now are on a nice cruise to Alaska, and they're having a great time, and they deserve it because they work so hard in the Mended Hearts organization over there. We also have an audience, besides the live audience here, we have Zoom here as well. So we're quite excited about that. The subject tonight is going to be on cardiac medications, why taking medications matters. We are very fortunate tonight by having resident PharmD pharmacists to go ahead and speak with us. Thurston Yan, Janice Leung, and Tingrong Yan, all going to be here over there. What's exciting is they're going to go ahead and they're each going to go ahead and give a little talk, a little lecture, which will be quite exciting. We're going to have the 3 of them speak. Then we're going to hold the questions until they're all completed. Then we will go ahead and have questions answered over there. We're going to pass a microphone around for the questions. I know people have great voices and they don't really think they need a microphone. But the people that ask questions in the audience, the Zoom audience cannot hear them. So they don't know what's going on. So we're going to go ahead and pass the microphone around, and we'll pass it to you. If you'll raise your hand, ask a question to the microphone, and they'll go ahead and answer the questions. They'll also go ahead and repeat the questions as well over there. Should be a pretty exciting evening over there. That's just about it. I want to go ahead and, first of all, thank the 3 individuals that are coming up here. They've worked all day today. They're giving up their time to go ahead and give a lecture. So right now, the first one that's going to come up will be Thurston Yan, and he will go ahead and speak first. Then we're going to go ahead and have Tingrong Yan come up, and then finally Janice Leung. So Thurston, I'll leave it up to you. If you care to come up here, introduce yourself, tell us a little about yourself, and continue. Thank you.
Thank you. Hopefully you guys can hear me. If not, let me know. I will speak louder. So my name is Thurston Che. Born and raised in Southern California, grew up in Chino Hills. Honestly, there's nothing interesting about me. I guess one fun fact is that I like basketball. But other than that, I would say nothing else is interesting. Yeah. All right. So today we will be presenting on the cardiac medications, which is part of the cardiac rehabilitation program. And we're going to focus on the common types of heart medications, the new heart failure medications, as well as the importance of taking your medications.
Your heart is a muscular organ that pumps blood containing the oxygen and nutrients your body needs. The pumping sections of the heart are the right atrium, right ventricle, left atrium, and left ventricle. In your heart, oxygen-poor blood flows from your body through large veins into your right atrium. Next, your blood moves into your right ventricle, which contracts, sending blood out of the heart to pick up oxygen from your lungs. Oxygen-rich blood moves out of your lungs into your left atrium, then moves into your left ventricle. Finally, your left ventricle contracts, sending oxygen-rich blood out of your heart to your body.
Follow your heart is advice that makes no sense.
Well, you can ignore that part right there. All right. Oh, no, sorry. Thank you. So, as we can see, the heart, there are different conditions that can affect the heart. We have heart failure, heart attacks, coronary artery diseases, heart valve diseases, any abnormal heart rhythms, or congenital heart diseases. Any one of these things can affect your heart. So why take your medications? And this is because non-adherence to the medications results in about 125,000 preventable deaths a year. And when individuals do not take their medications as prescribed, they face greater health risk and worse health outcomes. And by taking our medications, we want to reduce the chance of stroke and heart attacks. They would increase your survival, reduce any hospitalizations, and you can also help manage other diseases and control risk factors that can make your conditions worse. So knowledge is power. And as the quote shows, if you know how to take care of yourself, you can be the best version of yourself. And this is important because when it comes to your medications, you're the one taking it. So you want to know the brand and generic names. You want to know why you're taking it, how often you're taking it, how much you're taking it, side effects that come with it. Do you take this with or without food? And does this interact with any other food or any over-the-counter medications that you take? All these information will be helpful for you because you're the one taking the medication. So throughout this presentation, we'll be talking about the common types of heart medications listed there. We have the ACE inhibitors, the ARBs, the beta blockers, calcium channel blockers, antiplatelets, anticoagulants, diuretics, vasodilators, the digoxin, and statins. First off, we're going to be talking about angiotensin converting enzyme or ACE inhibitors. Now, examples of this class of medications includes benazepril, enalapril, ramipril, or lisinopril. And these medications, they're used to treat heart failure and high blood pressure. And how this class of medication works is that this will expand your blood vessels, which allows more blood to reach your heart. It also lowers the amounts of salt and water in your body, which helps lower your blood pressure. This class of medication, the side effects includes low blood pressure. It can increase your potassium. And if you do experience any swelling of the mouth or the lips, this is actually an allergy to this medication. And this can also cause a dry cough, which is, unfortunately, a lot of people do experience it. The next class is the angiotensin II receptor blockers, or the ARBs. Medications from this class includes valsartan, losartan, olmesartan, or telmisartan. And again, these class of medications, they treat high blood pressure. Now, for this class of medication, it works by blocking the action of this enzyme called angiotensin II, which is responsible for causing the blood vessels to narrow. Once it blocks it, it allows the blood to flow more easily, and it makes the heart work easier and more efficiently. And by doing this, it can lower your blood pressure. Side effects includes headaches, low blood pressure. It can also increase your potassium levels and also swelling of the mouth and lips, which is an allergy to this medication. Now, one thing about this class of medication is that it does not cause the dry cough that the ACE inhibitors causes. So people usually, if you're on the ACE inhibitors and you do experience the dry cough, your providers will actually switch you to over the ARBs, this class, since it will not cause any. The next class is the beta blockers. And examples of medications includes metoprolol or carvedilol. And for this class, not only can they treat high blood pressure, but also heart failure, any abnormal heart rhythms, chest pain, and it can also help prevent heart attacks. And for this class, it works by blocking the effects of adrenaline on your body's beta receptors. And when it does this, it slows down the nerve impulses that travel to the heart. And by doing this, it lowers the workload on the heart, which lowers your blood pressure. And it also lowers the heart rate and the cardiac output of the heart. And all of these things will help lower your blood pressure. And for this class, side effects include low blood pressure, fatigue, depression, cold hands and feet, and sexual dysfunction. This class of medications can also affect your glucose levels and can also mask any hypoglycemia symptoms if you are diabetic. And next, we will be having Tingrong covering the next few classes of medication.
Hi, everyone. My name is Tingrong. I'm the other co-resident here at Eisenhower. Interesting fact about me. I guess a random interesting fact about me. I used to try dog food at home with my dogs. Random, but I figured that would get your attention. So now I will go over calcium channel blockers. This is another class of medications. So calcium is essential in helping our muscles contract, especially in the heart and our blood vessels. So usually the medication from this class ends in pine, P-I-N-E, as you see amlodipine, nicardipine, and nifedipine. So what calcium channel blockers do, they reduce the amount of calcium that comes into your cells and therefore allowing our blood vessels to relax as well as our heart muscles. And once our heart muscles relax, you lower your blood pressure and allowing that heart to receive more oxygenated blood. And when you relax heart muscles, you allow your heart rate to decrease. That's why this class of medication is used to control high blood pressure, chest pain, and other irregular heartbeats. This class of medication is often well tolerated, but there are of course side effects that come with it. Some side effects include fatigue, flushing, meaning warmth and redness, usually around the face area or your neck and upper torso, as well as swelling in the legs, feet, and abdomen. So next class, I will talk about antiplatelet therapy. So platelets, when there's an injury to your body, platelets are sent to the site of injury where they clump together and form a blood clot. And this helps reduce bleeding and stop the bleeding. And this is a good thing when you have an injury with a wound. But sometimes these platelets become a problem when they clump together in your blood vessels, and that will stop the blood flow to your vital organs. And platelets do have the tendency to gather together around stents, any artificial valves, or any other foreign device that are placed in your heart or your blood vessels. And this is when antiplatelet comes into play, because they do keep the blood clots from forming and sticking together. So again, this examples of this class, as you all may know, baby aspirin, and there are non-baby ones, 325 milligram, and clopidogrel, prasugrel, and ticagrelor. So side effects, the same action that prevents clot can cause bleeding. Therefore, that's a side effect of this class is bleeding. With aspirin, you can also experience heartburn as well as ringing in the ears. So now I will go over anticoagulants. These are also known as blood thinners. I heard somebody just say, that's what you take. So anticoagulants, some examples include warfarin, enoxaparin, rivaroxaban, apixaban, and the bigatran. I put the brand names next to these generic just for you to easily identify them. So anticoagulants, they all work in very different ways. But the main goal is to make it harder for our blood to clot in our heart, our veins and arteries, and they can also keep existing clots from growing bigger. So when these medications are used to help reduce risk of stroke and heart attacks. And it is important to know that, again, the actions of preventing blood clot is bleeding. So therefore side effects are bleeding and bruising. And it's important to know that unusual symptoms of bleeding and bruising is what's concerning. So potentially finding your urine turning pink, red, or dark brown. This could also mean your stool that are dark red, dark brown, or black, because this could indicate any intestinal bleeding or urinary tract bleeding. Again, I just want to dive a little deeper into the medication warfarin. Our body uses vitamin K to help form clots. So warfarin essentially works opposite of that. They work against it in helping our blood thin out. So it is important to know that how do we get vitamin K in our body? Usually we get it from leafy green vegetables. This could be broccoli, kale, spinach, other leafy greens. And this doesn't mean that you should not eat any leafy green vegetables. It just means that you should you eat a consistent amount in your diet to make sure they don't interact too much with the warfarin you're taking. Now I will go over antiarrhythmics. So what is an arrhythmia? An arrhythmia is an abnormal heart rhythm, and it is a result from a problem with the electrical impulses and signals that regulate your heart. It can make your heart beat too quickly or too slow, or in general, just irregular. So how does antiarrhythmics work? There are this is a big class of drugs, and they all work very differently, but again, the goal is to regulate the electrical impulses that can result in terminating the arrhythmia and or stopping from abnormal rhythms to occur. Side effects include shortness of breath, chest pain, abnormal heart rate, dizziness, and sensitivity to sunlight. Now I will go over diuretic water pills. Interesting fact, before I started pharmacy school, when I first learned about water pills, I thought those pills are to hydrate yourself, not to do the opposite. But example in this class is furosemide and hydrochlorothiazide. It is used to relieve symptoms of congestive heart failure, water retention, and high blood pressure. So these medications work by helping the body get rid of excess fluids through urination. It can decrease the fluid buildup that are in your lungs and other parts of your body, and more oftentimes in your lower extremities. And this is because the gravity pulls the fluids into your lower parts of your body. And because diuretics cause frequent urination, side effects include dehydration, electrolyte imbalances, dizziness, and sensitivity to light. It is advised to take your diuretics in the morning or early afternoon to prevent going to the bathrooms multiple times during bedtime. Now I will go over this medication called digoxin. Digoxin is a medication commonly used for congestive heart failure and heart rhythm problems, specifically atrial arrhythmias. So how this medication works is it increases the calcium in your heart cells. Remember, calcium helps your heart contract. So, and it also reduces electrical signals in your heart. And this meaning that it can slow down your heartbeats and heart rates, but make them beat stronger with the calcium that is letting into your cells. And this makes it easier for your heart to pump blood throughout your body. Side effects from this medication include fatigue, slow heart rhythm, loss of appetite, and nausea and vomiting. Now Janice will go over the rest of the.
Hello, everyone. My name is Janice. So I'm the third co-resident, and I guess one fun fact about me is I like to take a nap every day after work when I go home. So I guess I might be passed out when I go home tonight. So I'll go over the rest of the medication in this lecture. The first class is called vasodilators. Some example of this medication in this class include isosorbide dinitrate, isosorbide mononitrate, and hydralazine. And they're used for high blood pressure and heart failure. And how it works is that it helps dilating the blood vessels to improve the blood flow. And this way it allows more oxygenated rich blood to reach the heart muscle so that your heart doesn't have to pump as hard. And the common side effects include dizziness. So make sure that you get up slowly from a lying or sitting down position. Other side effects include headache and flushing. And this usually it's a sign that this medication is working, and it usually goes away with time. For retention, if you do feel that you're gaining a lot of weight within a short period of time, then make sure you let your healthcare provider know. And this is the second class of medication called nitrates. It's basically, they're under the same class as the previous medication that I talk about, the vasodilators. However, the only difference is this one, it's a shorter acting. Therefore, it is used to treat acute chest pain. And it works just like the vasodilator, that it also helps relaxing the veins to reduce the workload on the heart when the blood is returning to the heart from the arms and the legs. And the side effects are basically very similar to the previous class, like other vasodilators. And usually this is given with aspirin when you have the acute chest pain. And one thing to note is that do not take this medication with the erectile dysfunction medication because it might cause you to have a very low blood pressure. So I'm just going to go over how to use the sublingual nitroglycerin. So if you have chest pain that is not helping by 2 to 3 minutes of resting, then you place 1 tablet of nitroglycerin under your tongue. Make sure you don't swallow, chew, or crush the tablets because it's meant to be dissolved by itself under your tongue. And if you still have a chest pain after 3 to 5 minutes, then you will put a second tablet under your tongue. And at this time, you will call 911. So while you're waiting for the assistant, if you still feel that the chest pain is not going away, then you can take the third tablets the same way as how you did for the first 2 times. So total, you can take up to 3 tablets in 15 minutes while you're waiting for the assistance. And make sure you don't drive yourself to the hospital because it's dangerous. You might have heart attack in the meantime. And keep the medication with you all the times in case you need it. Make sure you store this medication away from the direct sunlight, heat, or moisture. So the next class of medication is the statins. I'm sure maybe a lot of you guys are already familiar with it. It's the cholesterol lowering medications. And some of the examples include simvastatin, lovastatin, rosuvastatin, or atorvastatin. So they're used to reduce the LDL and increase HDL, which is the good cholesterol. And then the LDL is the bad cholesterol. And here I have some good analogy to help you have a better idea of what's good or the bad cholesterol. So for good cholesterol, you can think of like the oils in the engine. And this oil, it keeps the engine running very smoothly. And without this oil, the engine might stop working. However, on the other hand, the bad cholesterol, it's like, you can think of as like the grease or grime in your kitchen sink that it, in a long run, the water can stop running out of the kitchen drain. And this is like how bad cholesterol did in your body, that it can form a clot in your arteries. And in a long time, it can potentially cause stroke or heart attack. So statins are also called HMG-CoA reductase inhibitors. And the HMG-CoA reductase, it's an enzyme that helps our body to make cholesterol. So how statin works is basically it blocks our body from making this enzyme and therefore reduce our cholesterol. Some of the common side effects include diarrhea, constipation, muscle soreness, which is most of the common side effects, tiredness, abnormal liver function. So if you have severe muscle pain, reduction in the urination, or you see dark color urine, or you have like very bad abdominal pain, make sure you let your primary care doctor know these symptoms as well. So for the next 2 slides, I'm going to go over some of the newer heart medications. The first one is Entresto. Actually, this one, it's not too new now because it came out a while ago. It came out in 2015. So it has been around for a while. It is used just like the ACE or ARBs. However, they have the additional component that make this medication further relax your blood vessel and also decrease the stress on your heart. And the side effects, right, it's very similar to the other ACE or ARBs. The main side effects are it could cause kidney problems or increase the potassium in your blood. The second new medication, it's called Querlenor. The generic name is evaporating. So this medication is used to reduce the risk of hospitalization in patients with chronic heart failure. And usually this is used when patient cannot tolerate beta blocker that we mentioned earlier, or they're already on a max tolerate dose. However, their heart rate is still not controlled, then the primary care physician might put you on this medication to help further lower the heart rate. And some of the side effects will be low heart rate or high blood pressure. So another new class of medication, it's called sodium glucose co-transporter 2, and we usually call it SGLT2. Some of the examples in this class of medication include Jardiance or Farxiga. They're originally used to lower the blood pressure. I mean, not blood pressure, lower the blood sugar. However, in recent studies, it was found that they're also effective in decreasing hospitalization and mortality from cardiovascular events. So how it works, it's basically it reduces the reabsorption of the sodium, and it causes the body to get rid of the extra water through urination. And then this way it helps decrease the workload of your heart. Side effects, right, it can cause low blood pressure, urinary tract infection, and this is because how it works is it lower your blood sugar through urination. Therefore, it can also potentially increase the risk of getting urinary tract infection. And other side effects will be weight loss because you keep going to the bathroom, so it helps losing weight as well. So here we just want to share some important points with you, that it's important to take your medication on time. Make sure you don't skip the dose. If you do miss a dose, usually the general rule is take it as soon as possible. However, if it's too close to the next dose, then omit the dose and then just take the next scheduled dose. Do not stop taking your medication without your provider's permission. And when you go travel, make sure you bring your medication with you. And it's also good that if you have a copies of your prescriptions, just in case if you lose your medication, then you still have a copies of the prescription that you can go to the pharmacy and they can help you to get the medication. And know what interacts with your medications. Make sure you keep your medication in a cool, dry, dark place. Keep a current medication list to share with all your healthcare providers. So when you go to clinic visits, make sure you let your doctors or pharmacists know what medication that you're currently taking, including the over-the-counter medication, herbal supplements, any vitamins, so that they make sure that you're on the medication that are appropriate. And lastly, make sure you have enough of all of your medicines as well. And that concludes our presentation. Thank you.
Thank you, Janice. I'd like to introduce also Aaron Green. He's the audiovisual coordinator for Eisenhower, who's operating the Zoom, along with questions from here. Thank you very much. Along with our in-person questions, we're also going to be open for Zoom questions. So Aaron's going to jump in and help us out on that. Right now, George is in the background over there. He's holding the microphone. We'd love to have some questions right now. Anybody have questions? Just raise their hand.
Yes, several of the meds that have been introduced, mentioned here, have fatigue as a side effect. And I just wondered, what's the best way to counteract that? Meaning, you know, in my case, and in most of these people's case, we have to take these certain meds. Is there a way to counteract the fatigue aspect?
You know, that's a good question. My honest answer is there's really no way to counteract that. That's like, unfortunately, that's one of the, I know that's one of the most common side effects that of most of the medications. I think it probably depends on how much of fatigue that you're feeling. If it interacts with your daily activity that you couldn't really do much, then for sure I will discuss with the primary care doctor. Maybe there's something like they could lower the dose, or if there's alternative available, maybe we could switch out to an alternative. But there's no like a suggested way that you can counteract that side effect. That's my answer.
And I think you also to just keep in mind that, you know, these side effects can be common, but that doesn't mean you will experience them. So everybody does react to the medication different. And that's just a conversation that you may need to have with your provider to better assist in that area.
They really answered the question.
He's good.
One of the drugs that I take is clonidine, but I didn't notice it up there on the presentations. Could you tell me what class of drug that fits into?
So clonidine, it's belongs to a class called alpha-2 inhibitors. And that for that class of medications, it doesn't really treat the heart, it's more for high blood pressure itself. So for that class, we mainly treat it for high blood pressure only. Thank you.
Is there any reason if I'm back on the other subject, just having trouble with staying awake and being energetic. Is there any rule that says if the pill bottle comes from the pharmacy and says, take one a day, that we can't take it at night instead?
So there is no rule to that. If it's better for you, you can take it at night. If it makes it better for you. But I would also suggest to let your doctor know as well, just so you don't take too much of, because some medications are better in the morning and some are better at night. But there really is no exact rule. So if it works for you, you can take it at night.
Any other questions here?
Yeah, the importance of vitamin K intake, reducing vitamin K intake when you're taking warfarin is well known, but I'm not clear about some of the other anticoagulants like apixaban. Do we have to watch vitamin K intake with apixaban dosage?
No, you do not, because they don't work in the same pathway as warfarin. So eat all the leafy greens you can.
This is going to be a delayed piggyback on the fatigue part. Is it possible that some of the medications up there can have a delayed side effect? In other words, like on down the road, 6 months, all of a sudden the side effect kicks in? Or it wasn't there before?
Yeah, it's possible. Like one of the medication here that we mentioned, it could be like statins, because one of the common side effects, I'm not sure about tiredness, it could be one of them, but like muscle pain, usually patient doesn't feel it right away. They start feeling the side effects maybe like 4 to 6 weeks after they start taking the medication. So yes, some side effects doesn't appear right away. It might appear after you taking the medication for a while. But if the side effects that bother you or cause you interact with your daily activities severely, then yeah, like it's very important to discuss that with your primary care provider.
How important it is to take aspirin if you've been off the Eliquis?
Sorry, could you repeat that?
How important is it to take aspirin if you've been taken off Eliquis?
Oh, how important if you.
How important is it to take aspirin even if it takes Eliquis?
After you stop taking it, or you're
Yes, after you stop taking it.
How important it is to take Eliquis, right?
No.
Oh,
You take you're discontinuing Eliquis.
Okay.
Now they say take 90.
Take aspirin after you stop Eliquis.
All right, how important is it to take that aspirin? That's what my question is.
Did your doctor tell you to take your aspirin?
Did he tell me to take aspirin?
Yeah.
I don't remember him saying that, but
So
my memory's short anyway.
so you're saying you in general just wanting to take an aspirin?
No, ma'am. No, I had been taken off Eliquis, and somewhere along the line, I was up to Cedar Sinai, and this is where they give me the information. And they told me that to take, I think the doctor says that you can take aspirin. Now, what is that? I don't know. So you have an answer?
Oh, so what is an aspirin? It's an antiplatelet medication. So again, remember, as I mentioned, it helps with sometimes you're on it depending on what indication, and that I would not be able to answer unless I know more. But aspirin, sometimes people take it as a prophylactic or preventative measures for coronary artery disease. So that is essentially what aspirin is. Okay. Sorry about that.
How important is it to take a CoQ10 with your statin medication?
So what I see is CoQ10, there's some study that says it can help with the side effects of the statins, but I would say, however, the evidence is not too strong. So there's some uncertainty of whether coenzyme Q10 is really helping the side effects of statins. But I think it works for some patients. So I think it really depends on like patients individually. Some patients, they take it, but then however, they don't feel much difference from just not taking it. So I think that's why we also see like mixed evidence of this coenzyme Q10 with the statin. So to answer your question, it's uncertain, but it does help with some side effects in some patients' populations. I hope that helps.
I believe there's no Zoom questions right now. Well, I'd certainly like to go ahead and thank Thurston and Janice and Tingrong for doing such a great job. What a stimulating conversation we had with them. They really deserve a hand, especially since they've worked all day. Aaron is not here right now. I assume Zoom session is over. So at this time, we'll conclude. The only thing I'd like to go ahead and bring up is the Mended Hearts Organization. We're going to go ahead and stick around afterwards. And if you have any questions, we have several of our accredited visitors. Accredited visitors, those that don't know, are the accredited visitors. We actually go to the patients' rooms and speak with the patients and answer any questions and give them encouragement. If everyone would stand up that it's accredited visitors so we can find out who is here. So these are our accredited visitors. Stick around afterwards. We'd like to go ahead and have some conversations and get some conversations going afterwards. But I'd really like to go ahead and thank all the pharmacists again. What a great job you did. Thank you so much for coming here. We certainly do appreciate that.